Good afternoon, everyone. And hello from wherever you're tuning in from. I'm Brian Golden, the Sandra Rotman Chair in Health Sector Strategy and Professor of Strategic Management at the Rotman School and the Academic Director of the Sandra Rotman Center for Health Sector Strategy. I'm happy to welcome everyone from my Rotman North cabin in the woods, where social distancing is very easy. As we do in all of our in-person events, we wish to acknowledge the land on which we operate. And that is, for thousands of years, it's been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit River. Today, this meeting place is still home to many Indigenous people from across Turtle Island, and we are very grateful to have the opportunity to work on this land. Welcome to the 11th and final webinar in our webinar series, Managing Uncertainty, Adapting to and Learning from COVID-19, the Crisis. Our goal with this series is to bring the Rotman community together and offer our evidence-based perspectives and advice to help you cope with the dramatic changes that are taking place as a result of the COVID-19 pandemic. Today, we want to talk about the merging and management of public health. As this is our final episode, we thought it would be good to take stock of what we have learned so far and provide some support and guidance for business leaders who may be struggling with the question of what reopening looks like this fall. Now that much of Canada is in stage 3, thankfully. Many have lingering concerns about who is ultimately responsible for reopening safely and how to demonstrate leadership in an uncertain environment. Now, this has been the theme of the entire webinar series. Joining me today are Anita McGahan, Avi Goldfarb, and Alex Yao. Anita is a university professor at the University of Toronto and is a professor at the Munk School of Global Affairs and Public Policy and a professor of strategic management at the Rotman School of Management, where she holds the George E. Connell Chair in Organizations and Strategy. Her research is focused on industry change, sustainable competitive advantage, and the establishment of new fields. An area of particular interest to her is global health and the diffusion of knowledge across international boundaries. Avi Goldfarb is the Rotman Chair in Artificial Intelligence in Healthcare and Professor of Marketing at Rotman. Avi is also the Chief Data Scientist at the Creative Destruction Lab, Senior Editor at Marketing Science, and a Research Associate at the National Bureau of Economic Research. His research focuses on economics of technology. He is the co-author of the Globe and Mail best-selling book, Prediction Machines, The Simple Economics of Artificial Intelligence. Recently, along with Ajay Agrawal, Joshua Gans, and Mara Lederman, he authored The CEO's Guide to Safely Reopening the Workplace in MIT Technology Review Online. And lastly, Alex Yao, proud MBA graduate of Rotman 2014. Alex is the president of the Canadian Retail at the Northwest Company. In this role, he's responsible for over $1 billion in revenue and a workplace of over 3,000 people, looking after the entire value chain from procurement and marketing to logistics and store operations. The Northwest Company operates retail stores in Canada's north. Many of their stores are remote in Indigenous communities and often in places where they are the only store around. Northwest managed to keep all of its stores open throughout the pandemic. If you can think of the supply chain challenges that we're experiencing here in Toronto, we can only imagine the difficulties of access in the north. I'm looking forward to learning from Alex's experiences. Before we begin the discussion, I want to invite you to submit any questions you have using your Q&A button at the bottom of your screen. We'll try to get to as many questions as we can in the second half of our hour together. So I'm going to begin, and let me begin with a question to Avi. Avi, you've written about how a public health problem has become an economic one. Can you tell us what you mean by that and how managers can think about this problem as they consider a return to normal business operations?
Sure, thanks. Thanks for inviting me on this, and thanks everyone for participating and listening. So it's clear we have a health problem. Nobody knows when this COVID-19 crisis is going to end. And it is very much a health and a public health challenge. It's a medical problem. That said, the medical problem creates a management problem. As a manager, you have little control over when this crisis is going to end. But but your places of work are opportunities for infected people to infect others. And so when we think about the management problem, it's whether and how to reopen your business, given that workplace spread of the virus remains a threat. You're not gonna be able to do much about the broad health problem, but you can reduce risk while still enabling your business to operate through management. The underlying technical problem is that we don't know who has the virus. We don't know who had it. We don't know who's never had it. We don't know who's infectious and who could be infected. If we did know, there wouldn't be an economic crisis. It would be straightforward. We take the infectious people, we'd make them isolate, and everyone else could go about their business as if not much had changed. The problem is that we don't know who's infectious. And because of that, we need to think through who to let into our workplaces, and once they're there, what to do about it. When we think about solutions, there's two categories of solutions. Many of the solutions we've talked about so far and that we're all becoming familiar with are what we call always-on solutions. Always wear a mask in your workplace. And always stay 2 meters apart within the workplace. Always do things, if you can, do things outside. These are always on solutions that even if the virus gets into your workplace, you can still protect your workers. The other class of solutions are things we call information-based solutions. And these are solutions that are probabilistic and that essentially what you do depends on what you know. So testing is an information-based solution. If you test everybody before they walk into your workplace, then you can use that information to decide whether they should be allowed in, whether they should be sent for secondary testing, whether they should be sent home or something else should happen. So there's a health problem. And at the country level scale, most managers can't help with the health problem. But the health problem creates a management problem. And that's when you can do something about it. And with respect to the management problem, you can think about it as there's a set of always-on solutions and there's a set of information-based solutions. And that's how Mara, Joshua, Ajay, and I structured the problem in our article. And that's how we continue to think about it, both in terms of our writing and at the CDL.
Thanks, Avi. We'll come back and pick up on some of those ideas in a bit, I'm sure. Maybe I'll turn it over to Anita now. And Anita, you often think about the trade-off between health outcomes and economic outcomes. How do we think about that split or that division with COVID and trying to get COVID down to zero?
These are two complicated questions. The first one about the trade-off, and then the second one on how to get COVID down to zero. On the first question of how do we break the trade-off, we have to enhance a sense of mutual responsibility, and we really need to change the culture of the way we think about our relationships with each other. In the short run, we have to keep the economy open while we fight the virus in order to stay healthy. Our economy is essential to our health as well. And as we all learned, keeping the economy shut indefinitely is it's not good for anyone. And I hope Alex is going to have a chance to talk a little bit about how his company sustained health in the Canadian North as an example of that. So how do we do that? How do we break that trade-off between keeping the economy open and mitigating COVID? There are three things on my list here. In the short run, I think what we have to do is really support businesses in implementing the public health guidance here. Distancing, hand washing, masks, testing. We have to, as Canadians, really sort of change our sort of internal compass away from that kind of Canadian toughness. Oh, I have a cold, I don't feel, I'm gonna push through it, to an attitude of responsibility. We have to get away from making people who declare that they're worried that they may be positive, making them feel bad for making that declaration. We have to support each other in actually communicating more in the short run. In the medium term, I think extending that idea of mutual responsibility means taking better care of each other, especially essential workers, anybody who's vulnerable, elderly, people who have pre-existing conditions, but also vulnerable because their incomes are low. They're living in housing that doesn't allow them to follow the guidance easily because they have insecure housing, or there's too many people living together to be able to sustain the 6 feet apart thing. We need to think about, the Canadian government has done, I think, as good a job as could have been done on redistributing income and creating a safety net. And we need to think about continuing that and dealing with some of the structural problems that have made vulnerable people vulnerable. And then in the long term, we need innovation. We need to figure out what's important to us in our society, things like education, especially primary education. In healthcare, of course, how do we do earlier diagnostics here? How do we build infrastructure to allow people to maintain distance and so on? And, we have to think about our financial systems and whether they're working properly and deal with environmental challenges. We have to channel resources towards solving those problems instead of, eating unhealthy foods or consuming stuff that's not important to us. And that's what's going to lead to resiliency and equity and effectiveness, and not just efficiency in our society. On the second question of how do we take COVID to zero, I think probably we can't. I think we're in a situation now where it's too late. I think we have to wait for a vaccine and better treatments, and the disease itself is changing. The nature of the disease itself is likely to change over time, but I think we're going to be living with this disease for a while. Even the vaccines we have are likely going to be more like the flu vaccine, which reduces your susceptibility rather than eliminates it. We'll see.
Well, I guess the good news, at least coming out of Australia today, is that COVID has reduced the incidence of flu with all of our social distancing and all of our precautions. So we may get a little bit lucky there. Thanks for that, Anita. Alex, let me turn it over to you. True North has been open since the beginning, which is remarkable, but also, clearly has been so necessary in your community. Can you tell us, or many communities, can you tell us how you've responded as a manager, thinking about both your responsibility for the communities, but also the responsibility you have to your staff?
I think a lot of what Avi says really resonates with me in terms of like the always on solutions, right? I'll talk a bit about how we responded at the start, and then I'll talk about where we are right now. So at the start, obviously, like many other managers, we're dealing with a lack of information. And so what we had to do was basically almost go into crisis and scenario planning mode to say, okay, well, based on, 3 months out, 6 months out, like what are the different ways, and, what are the big drivers? Like what's the worst case scenario? What's the best case scenario based on what we know? And then we had to layer on top of that our mission, right? Like our mission statement is to bring products and services to our customers that allow them to live fuller lives in their communities. So if you take that as the overarching mission statement, the priority becomes how do we ensure that our customers can get the products they need, even in any kind of situations. We planned out situations where there would be a COVID case in the community. We planned out situations where people had to isolate. We planned out situations where we had to shut the store down maybe because there was an outbreak. How will we get food into the community? And then that drove out some of the actions we had to do, right? So for example, we straight opened up a website for online ordering in 2 weeks. It was very basic, but we had to do that so that people had a chance to either phone in orders or without coming to the store. Provide, curbside delivery for elders who might be vulnerable, who might not have cars. So we partner with the community to find, people who are willing to pick up orders and deliver it to our elders, because we're a community-based retailer. So, an example was, we said, okay, let's build a central fill capability. Let's have hubs there where we can actually pick orders out and ship them to our stores if we have to shut them down. So there was a lot of what we had to do was try to structure the uncertainty and try to put boundaries around it. So then that allowed us, by looking at those variables, allowed us to really drive out the actions that we had to do. And therefore the cost we also had to invest, given our overarching vision of really maybe able to provide supply and certain supply to our customers. So that drove out costs and actions, both for our employees and for our customers. And then that necessarily drove other things we had to do, like maybe we had to drop a whole bunch of things just to fund those initiatives, right? So on the employee side, like we were pretty clear we had to get product to customers. We were also pretty clear we had to protect our employees. So there was a whole bunch of initiatives on the customer side that I talked about, but on the employee side, we hired 100 people, 100 summer students, 100 contract workers to move into our stores to provide backup in the course of like 3 weeks. We moved them to our communities, we put them through quarantine, we trained them up. We moved all of our stores we reviewed the hours of operation so that people could have, could work on separate shifts so that if there was an outbreak, right, we were able to kind of keep the store running. So we worked through initiatives on both the employee side and as well as on the customer side, knowing that we would not compromise on our ability to support our customer. So that was kind of the first 3 months, which was really just a mad rush. And now that we've gotten into, I would say, a bit more of a steady state, what we're working through right now is the same scenario planning. We are still hampered, I would say, by the lack of information, right? The fact that testing technology is still evolving, that there's still a lot of false negatives, that there's a trade-off between speed of the test and the accuracy of the test really drives a lot of, what we can control. But what we can control is, again, what are some of the initiatives that we know that we always have to have in place, as Avi said, always on solutions, right? That we know will mitigate our risk. And again, this drives out costs that we have to invest that we'll not compromise on, but then it forces prioritization in terms of initiatives that we have to do next year. And we know that protecting our employees and supplying our customers is a priority, and everything else that doesn't align to that honestly has to go by the wayside until we get more information about how to triage decisions, to Avi's point, informational solutions.
Thanks, Alex. And if I can follow up a little bit, you started off by talking about the True North's mission and your responsibility to your communities. But part of the article, Avi's article with his colleagues, talks about the cost-benefit analysis that has to be made by every manager, every leader. Can you talk a little bit about whether that cost-benefit analysis was part of your discussions in the early days, or whether the decision was, we just need to do this? We'll have that discussion about cost-benefit later, but we've got to stay open. Yeah,
it did, but it was in a different order of discussion. The cost-benefit analysis wasn't the first dimension of discussion was, what do we need to do to ensure that we can support our customers and employees? That was a non-negotiable. That's how we thought about it, given our mission statement. So there, the cost-benefit analysis wasn't done. Where the cost-benefit analysis was done was, once we've filled the bucket with all the initiatives we need to do to support our customers and employees, what other initiatives do we have? And that's where the cost-benefit analysis came in. What we ended up doing is deprioritizing a whole bunch of stuff off our plate, whether it be capital spending or whether it be, time and resource or, money, operating expenses. That's where the cost-benefit analysis came in. Knowing that we couldn't compromise on customers and employees, what else could we take off the plate? That's how we did it.
Thanks. And we'll come back to you in a bit, a little more on that. Maybe I'll turn over to Anita now. And this is a bit of a mouthful of a question, but you've written about the importance of good contract tracing to contain the problem and to protect against uncontrolled resurgence of COVID-19. Do we have the line between public health responsibility and management responsibility drawn appropriately, or does government need to take a more active role in establishing policy frameworks for private business?
Thanks, Brian. It's fascinating to hear Alex talk about what happened at True North, because there's so many different ways in which organizations are dealing with this challenge, and I think businesses vary quite widely in their compliance with the guidelines generally, and their ability and commitment to be able to do that, and their ability to do contact tracing. I think there are three main reasons that we need more government intervention in contact tracing. First of all, it's very easy to do contact tracing badly. It's a lot of work. It has to be done fast, efficiently, and effectively. And there's the opportunity to learn at scale if you have a centralized body that actually takes on responsibility for calling people, pursuing them, and being able to convince people that they're at risk and that they need to take action. And that work of doing contact tracing is so extensive that it makes sense to have a centralized body that takes responsibility for it. The second is you need the authority of the government to compel adherence to the guidelines of quarantine after contact tracing. It would be very difficult, I imagine, for Alex to call one of his employees and say, hey, at work you were potentially exposed to somebody, you have to go into quarantine. And one of the reasons why that's complicated is because Alex also has to manage the way he pays people. And if you're sending someone home and they're not going to be paid during the period when they're not at work, that's a kind of conflict in the role that a manager has to play that's problematic. And then the third reason is, and I talk about this a little bit in the article, is that contact tracing gives businesses too much information and control over who you interact with, who employees interact with. We're all, three of the four of us are employees of the Rotman School. Do we really want the Rotman School's central leadership, which is, by the way, very trustworthy and very effective, but do we really want a database of who each of us interacts with every day, who we spend time with, how we spend our time, to be in the hands of an employer here? You can imagine some employers, especially those that are under extraordinary pressure, using that information in ways that don't align employee interests with the organization's interests. So my view is that business should be focusing on safety, on, certainly businesses should be keeping track of business contact events, such as when somebody comes into a True North retail store. That information should be accessible, but actually implementing contact tracing, I'm arguing, should be a governmental responsibility.
Thank you. And I'm struck by some of the generational differences as well. I think everyone in the world knows every meal my 20-year-old daughter has eaten and where she's eaten and who she's been with over the last 6 months. And she's posted that for everyone to see. I'm also struck by your comment about how contact tracing can be done so badly. I was excited when the government of Canada sent us that announcement that we've got this new contact tracing app. And when I tried to download it, I found out that my phone was too old for that. And of course, the app is not available for anyone like me, the elderly, who has an old phone with an older operating system, or for lower income people who aren't able to access it as well. Clearly a challenge for the app. Avi, let me come back to you now. Yeah, this is a unique crisis in one sense, but there are some commonalities to challenges we faced in the world before. Are there management tools and practices that can be deployed to help guide decision-making under this unique period we're in?
Yes, lots is new and lots is familiar. And actually, just building on this conversation that we were just having with Anita in particular now to some extent, is an issue around privacy and tracking. And then there's almost like a 2x2, corporation versus government, and tracking and privacy. In my own research, and especially in the research of my frequent co-author, Catherine Tucker, there's a lot of evidence on costs to privacy as well as benefits. Privacy is a right. What makes it important as a right is that it's not free. And we have a trade-off between privacy and other things. In the context of this pandemic, that trade-off is really obvious. So the contact tracing, so maybe we don't want a corporation or our employer to have that data. That's a privacy point. But I think a lot of us also don't want the government to have that data. And that creates a problem. And many of the technical challenges around this app are all related to privacy. If we didn't care about privacy, it would be much more straightforward to build an app on really even old phones that don't have the same settings that the newer phones do. And so privacy in this context is, it's valuable. Like, there's a reason we care about it, but it is costly. And my own research is about the cost of privacy in terms of advertising effectiveness, and maybe like, who cares about advertising effectiveness? But here it's costing lives. And so we need to, when thinking about a fundamental management question that we've been talking about for the last 10 years, it is now central, which is how much are we as an organization, and more importantly, perhaps how much are we as a society willing to pay in order to protect privacy? And does that threshold change when the question is innovation for companies that are trying to sell us stuff and online advertising relative to innovation in public health that's trying to save our lives from a deadly virus? Right now, in many ways, the answer is the rules we had for the corporations and online advertising are pretty similar to the rules we have in saving us from a deadly virus. Maybe that's the right way to think about it. Maybe we should have been a lot stricter with the corporations on the advertising, or maybe we need to think about a different threshold on with the deadly virus, especially to Anita's point, perhaps with respect to what the government, to the extent that we generally trust our government in Canada, what the government says and what the government knows.
Thanks, Avi. Just as a reminder to the audience, we're going to be finishing our formal questions with the panel shortly. We want to make sure that questions that have emerged in their conversation with you get back to them. So please use that option at the bottom of your screen to type in any questions, and we'll do our best to get to all of them as we go. Alex, let me go back to you. Again, you've been open since the beginning of the pandemic, and you've obviously learned a lot of lessons about what works and what doesn't work so well. If someone were just starting a business now or just reopening a business now, what advice would you give them?
Yep. So just to give a bit of context, because the business unit operates across a lot of different geographies and dimensions. So the Northwest Company operates a number of retail places in the north. That's what we've talked about. But I actually also have a logistics service center. That's a warehouse environment. And I also have head office team, right? That's part of the Canadian business. The reason why I say that is because, they play out a little differently in each of these kind of workplace settings, right? In a retail environment, our priority is to really ensure that we can keep things open for our customers while keeping our employees safe. That's our northern banner that we operate up there. In the warehouse, it's kind of a similar situation, except that you have more of an opportunity to pivot and toggle if you have an outbreak, because you can hire more staff, versus in the north where we have a limited number of staff, limited number of customers. Outbreaks can happen really fast. And head office, again, it's a very different consideration. The first piece of advice I would give is, I think, especially if you belong to a business association, like I've found the Retail Council of Canada to be extremely helpful for a number of different reasons. Number one, every company is trying to figure this out. And the Retail Council really, or these business associations, are so valuable in terms of sharing best practices. Like they've worked with, they've developed a playbook for us for how to reopen based on different retailers' experiences with different public health authorities, right? They've advocated for us in terms of getting clear accountabilities between us and public health and the government, right? How do we, for example, mask mandates? Well, whose accountability is it to enforce it, right? Anita, you talked about that. So we've we've leveraged that to really try to get some clarity, give our point of view on what the mandates should be and how do we operationalize that. So the first step would be really reach out to your local business association, reach out to business groups that you belong to. I think number two is really ensuring that you have a contact in public health or somebody who has a contact in public health. What we found is that, again, going back a bit to the privacy conversations we've had, like we don't want the data, right? But what we want is one to support the operationalization of contact tracing and quarantining. And to do that, public health is probably the best placed group to do that. What we have found is that there's, just because everybody's figuring this out, there is a significant amount of variation in terms of how public health executes in a city or in a region, right? The level of responsiveness, the level of guidance we get can be quite different. And what we found is getting ahead of that and really getting in touch with public health, really understand the process and guidelines just allows you to just move a lot faster when an incident does happen. So that's the tactical advice I would give from a retail standpoint. On a head office standpoint, because I see some questions around head office, again, it's the same thing. Like we're reaching out to fellow companies to understand what they're doing. Like I'm personally looking at research from researchers around what does it mean to move to a virtual environment? It's a bit different when you're a technology company versus say we're a retailer, where that kind of, and layered on top of that is what kind of culture do we have? What do we think is going to make us most effective in the new world of COVID, right? Like for us, our culture is still based a lot of, because we have a very complex business, it is still a bit easier to get work done in person, right? So there is an efficiency and effectiveness trade-off. So we're trying to look at companies with that kind of environment culture and learning what they're doing. We're leveraging research that's happening and thinking about how that impacts head office. So as an example, in my mind, part of what's going through my mind is, I think we can work virtually in a team, but my biggest worry right now is how do I keep that culture with new employees when I don't have the typical onboarding tools and processes, right? Hiring can happen virtually, that's fine. It does mean you have to spend more time, but the biggest part I'm thinking about is onboarding. But that's specific to my company and my business unit and the culture we want to develop. So I would say to people opening a head office or, more of an office setting business, is really understand what kind of culture, what's your working process and environment, and look at similar companies, reach out to your contacts, understand what they're doing, and then marry that into where do you think your gaps are, and then come up with ideas to address that.
Great. Thank you. I'm going to sort of ad lib here a little bit because we've got some questions coming in. And there's an interesting question about that I think departs from Avi's article, but I'd like to hear the perspective of all three of our panelist speakers. So Avi, in your article in the Technology Review, you talk about the need to do the cost benefit of staying open. But the benefits often accrue to the business owners, and the risks or the costs are borne by employees. And we know that many employees who are bearing these costs, the essential workers, are low income, relatively disadvantaged. So I'd really appreciate the thoughts of all three of our speakers, Avi, Anita, Alex, on your thoughts about the cost benefit and who benefits and who bears the costs. Maybe we'll start with Avi.
So it sounds like when you're thinking about cost benefit, that description that you just walked through seemed to have the assumption that the employees still get paid if they're not working. That's another cost benefit calculation. So, under a version, yes, the employer bears all the costs. Yeah. If the employee stays home and they shut down, but they keep paying their employees. Mm-hmm. Some businesses are going to do that. A lot of them aren't. Yeah. And so now we have to say, well, who bears the burden if the employees come into work and get paid, but they're also bearing the risk, versus if they don't go to work and don't get paid and instead get some government benefit or something else. It's a much more complicated question than I think you put forward. Frankly, I think Anita and Alex have better expertise to think through the answer than I do. But all I can say is that I think the question isn't just a straight, are employers exploiting low-income employees by making them come to work? That's only going to be true if you think the employer could just keep paying and the revenue keeps coming in anyway. So I'm going to pass it on to Anita and Alex to maybe provide some help on answers.
No, it's great that you challenge the assumption or the premise of the question, because it is a more complicated question than the simple I'm going to be bearing the cost coming to work, taking those risks. Anita, thoughts about this?
Yeah, I agree with both Brian and Avi about the fact that this is complicated, much more complicated. So there's also an intertemporal piece to this. When we were thinking about being closed down we were hoping that we would be closed down for a relatively short period of time. There was discussion about vaccine being available this summer. There was a sense that this thing could be handled, relatively quickly. Then I think the idea that the employer would create some sort of a bridge framework to keep people paid and to, then you might ask this question of, was that fair? Were essential workers more vulnerable and so on? But in a framework of less vulnerability overall, you can see a logic for what happened. Now I think we can see that there are so many structural problems in the way that let me put it this way. This disease has made vivid every vulnerability in the structure of our economy and the way that work is structured. It is simply not right and not fair that essential workers are underpaid relative to others and are at the front lines and are vulnerable. There's something there that is not working. We have to address fundamental problems in our society, like the lack of access to education for people of color, especially vulnerable people who are low income, people who don't have the kind of access to the kind of housing that we need to implement in order to childcare. There's all sorts of problems associated with the way that work is structured, especially for people who are low income, that go beyond the responsibilities of individual employers and require a broader response from all sectors of society, including associations, government at all levels, and business representatives, and the public at large to address effectively.
Thanks. And Alex, your thoughts from a very different vantage point.
Yeah, it's complicated, right? I think but I think if I had to simplify it, this is what COVID has done is really exposed a very classic who bears the cost, right? Is it the government? Is it the employer? Is it the employee? Is it shareholders? Like those are all the stakeholders we have to work with. So as an example, childcare, right? In the typical normal world, there's childcare. Well, what do you do when employees can't come to work because of childcare? Does the employer bear the cost? Is it the government's responsibility to find alternate solutions? Like there's no right answer. And as an employer, you don't have the ability to fully answer those questions, right? So I think what my view is, I think you just have to adopt certain principles that guide your decisions, but what do you think is the right thing to do? So as an example, what we said was, okay, we'll based on best public health guidance, we will invest wherever we need to do to ensure that we keep employees as safe as we can, right? So if public health tells us we have to get when we saw the retailers doing plexiglass shields, we went out and did it in 2 weeks, right? Because we thought it was the right thing to do. Now we're looking at what is the latest guidance in terms of do we need to look at more beyond masks, right? What's the cleaning and sanitation? Like what we've made very clear is that on employee safety, we will put in place the best practices based on public guidance. So that was principle number 1, right? Principle number 2 is we don't want to incentivize people to come into work if they feel like they're sick, right? Because we don't want to create perverse behavior. So what we said was, okay, if they have to quarantine because of COVID, that's just paid leave, that's just given, right? Now, if they don't feel well, there's paid sick leave. We do have paid sick leave in our policy. So we try to ensure that, without creating whole new programs frameworks, we just said we're not going to compromise employee safety, and we don't want to encourage people to come into work if they're sick. That was kind of the principle. Then you start getting to, so you just have to adopt some clear principles, and it drives out some actions. It does mean that, for example, principle number 3 is we will try to accommodate as much as we can people to do their work when they can work from home, right? But in cases where they can't, because maybe they have to come in to do accounting work or payroll work, then we'll look at ways to keep them safe, right? So those are the 3 principles. We had to draw the line at things like childcare because that's just to get into government accountabilities and whose accountability is. But I think the way we just had to try to simplify the uncertainty down to 3 simple principles we could communicate to our staff, and then drive our actions out of that. So that's my straightforward. That's my best answer, because I don't think you can try to solve the whole world's problems here. You just have to do your best by your employees, your customers, and to some degree be responsible to the business as well.
Okay. So I really love that multifactorial thinking of the mission, the business, the perspective of your staff, the perspective of your customers, and learning as you're going. Because as you say, there was no playbook for this. Anita, I found the article you wrote with your colleagues at the Monk School very interesting, and particularly around the need for global cooperation. So I'm taking this up a little bit of a level. And it seems to me we have the right conditions for a bit of a tragedy of the commons phenomenon, led, and I use the word loosely, by the US. Do you have any thoughts about how to get the US to be thinking more globally beyond what some of us can do on November 3rd?
So I should confess that both Brian and I are Americans as well as Canadians, and have that as our background. Brian, is that correct?
Oh, well, I gave it up about a year ago, but let's not.
Oh, did you? Okay. But we have backgrounds anyway in the United States, both of us, I believe, from New York. And, it's very interesting to see the least. It's actually it's a tragedy actually in the United States to see the devastation that we're facing. I'm calling in today from California, where I'm visiting family in the midst of wildfires. There's ash coming down outside the window here. It's quite, these crises are interconnected, and they relate to a very broad set of problems in this country that actually do connect to what we've been talking about, what Avi and Alex and Brian have all raised about the vulnerabilities of people who are not enfranchised in the system of wealth creation that has propelled economic growth in this country, the United States, for the last couple of decades here. You know, the current challenge is to figure out how to, technology is very centralizing of wealth in general. So the challenge is, how do we figure out how to get good jobs, good housing, good education, good opportunities across the population, and motivate people to want to act as if we have a common public interest in tackling some of our largest challenges. And that's the COVID is a global disease. We've all seen that the actions of one person, in this case in Wuhan, in that market, and have global consequences here. How do we create enough of a sense of global mutual responsibility and global enterprise for us to, you know, work together across boundaries to try to manage this problem? It's an enormous issue, and it is really the defining issue of this century, first around COVID and of course also around climate.
Thanks. Let me see if anyone else has a thought about that. No. Okay, I've got other questions piling up here, so great. You know, one question that's just come in, and maybe I'll elaborate on it, is for any of our panelists to comment on the shift from the short-term crisis management to shifting into long-term management of COVID. You know, what's changing? Alex spoke a little bit about this. You know, what have we learned about this experience that we'll take with us into the future? I see Anita's hand up. Great student.
Well, just briefly, you know, Alex, you mentioned that you put up a website where people could put in remote orders, could put in orders remotely. Innovation like that, breaking trade-offs by using technologies to solve practical problems, I think is where we are now. You know, at the beginning it was, okay, how do we shore up? How do we take care of our people? How do we make you know, the places that we currently work safe? Now we're moving into a phase of, okay, can people stay at home? Who has to come to work? Some companies, as you know, are announcing, you know, that they have no intention of reopening these big headquarters offices. And I believe there was a question in the chat around that as well. We've been talking a little bit at the Monk School about the implications for the financial area of Toronto and other cities. You know, do we expect a resurgence of old patterns of commuting and things like that? So we're moving now into a phase of, I would say, very proximate innovation. How do we make things better under this new regime of rules around managing the disease?
Alex or Avi, do you want to chime in here? Just raise your hand if you do, and I'll call on you. Okay, I've got Avi, you raise your hand first.
Ah, I wanted Alex first. Okay.
Okay, Alex, let's shift. Alex, you're on.
Coming more from an industry lens, I will agree that there's going to be innovation, and it's fascinating to see how this is affecting industries. And I'll speak about retail and the retail value chain I see more closely. Like, obviously, you're seeing a huge shakeout, right? Like, you're seeing big box retailers like Target and Walmart just announced results. Like, you know, what you're hearing Target and Walmart talking about is they're seeing 3 years of e-commerce like adoption that they're seeing in 6 months. Right, and what you're seeing is businesses starting to get sucked into, you know, these big box retailers, and you're going to see like a slowdown in small business formation. So obviously, there's going to be industry structure that's going to change, right? Apparel retailers are dropping out, big box retailers are accelerating investment. So there are going to be lots of winners and losers. So that's a bit. So as a medium-sized company, I have to figure out how we're going to navigate this change industry. You're starting to see that in the conversations between Walmart and the food processors, right? It's driving a lot of churn and change in the industry. You know, another example would be a supply chain. I think, you know, while supply chain has been strong in Canada, I think it's exposed the downside of a very lean supply chain, just-in-time supply chain that we maintain. You've seen all the manufacturers shrink down from, you know, having lots of flavor and line extensions to like the core flavors because they have to keep product in stock. But what they're also doing is they're using it as a chance to really weed out all the underperforming brands that they would have done, you know, maybe weeded out over the course of 3 years. Now they're doing over a year. Like, Pepsi just announced they're getting rid of the Walla brand, juice brand that, you know, does $300 million in sales that they bought in 2004. they probably have made that decision 3 years out, but now they're just junking it because it's a chance for them to do so. So I think there's going to be a lot of winners and losers, both within industries, but also across industries, both innovation, but also I would say consolidation. And the winners are going to get bigger, I would say, and the losers are going to drop out. I think that's what's going to happen. And, that drives a lot of, that forces us to think very strategically about how to navigate a very changed industry structure would be my sense. And so that's a bit of where our minds are thinking to now.
Thanks, Alex. Avi, thoughts?
So in thinking about how those are all, fantastic, maybe building on where Alex was, originally, I think a lot of us and a lot of managers thought that the doctors and the public health people and the scientists were going to solve the problem and bail us out quickly. And so we were just going to wait. Okay, we'll shut down. We'll do a few things. It's kind of kludgy, kind of awkward, but we'll do a few things, and then the medical establishment, doctors will save us in some sense. And then it became clear that was going to be a bit of a long haul because it's a hard problem. It's a hard scientific problem. And then I think some people thought, well, okay, the government is going to solve our problems for us. They're going to figure out how to do great contact tracing. They're going to do testing at scale. The government will solve this problem for us. We don't have to make these decisions because prime ministers and presidents around the world will tell us what to do and they'll solve it for us. I think as we're now approaching 5 or 6 months into this, managers are realizing they really need to do a lot themselves. It doesn't seem like we can rely on the medical establishment, on science to solve the problem in the short term. I think we can rely in the long term, but the long term could be a long time, or too long, at least for any given business. And governments seem to be very slow in a lot of things, particularly around contact tracing and approving testing methods and things like that. And so increasingly, I think managers are recognizing that it's up to them. They need to think through these decisions on who do we let in, what kind of always-on solutions do we have, which information-based systems do we invest in? Is a temperature check enough? Or do we need some kind of rapid spit test? It's not as good as a perfect test, but it's probably better than a temperature check. And so thinking through these questions is, I think, where many managers are landing. And as a plug for a colleague, Joshua Gans has a daily newsletter going out right now around the economics of COVID. And this week it's focused on testing and information. And a lot of these management questions that have come up from Anita and Alex and me, he covers very clearly, laying out the issues. So just as if you're thinking about these issues and you want to know more, it's worth checking out his emails.
Thanks, Avi. We've got a couple of final questions. I've been trying to curate as we go here. And let me get to my second to last question for everyone. And that is, how do the three of you envision life and work in 2025? Is it back to where we were in 2019, or are some of the changes going to be with us, sticking with us indefinitely? Anita, you've had a chance to catch your breath.
Well, most of the engines of economic growth around the world now are in less developed economies, in emerging markets, and there are going to be some significant consequences, I think, for Canadians and for Americans, for example, if we can't find a way forward to reopening our borders and to reconnecting with reinvigorating trade across international boundaries, national boundaries. So there's a lot of uncertainty about the macroeconomic growth picture in the first place. And much of the nature of work will key off answers to questions about whether or not we'll continue to, enjoy an international comparative advantage-driven economy. It's hard to believe that some of the most immediate opportunities for improving work that existed before COVID won't be implemented. And we've already talked about some of them, continuing for many people to work at home, figuring out, working on problems like childcare, figuring out how to make the elderly more engaged and productive. Elder care obviously has to be completely rethought. There's a lot of opportunities for improving each industry, every industry that have been revealed by this crisis that I think will be, implemented and those innovations can take hold. So there's a long-term question that will shape the 2025 work environment that has to do with macroeconomic framework. There's short-term opportunities for innovation. And then in that middle space, there's really an innovation challenge. And I'd love to hear what Avi thinks about this, since you think about AI and data and analytics day to day. Do you see, Avi, an opportunity, on a time frame like 5 years to implement machine learning, AI, and so on to try to address some of these problems?
Yes, but probably not as much as I'd like. So how do I think about this? There has been a massive digitization of just activity over the past 6 months. So doctors used to meet patients face-to-face. A lot of the time they've realized, we can have those on video. Now, there's lots of things that are worse about video appointments, but one thing that's better is we now have data on video of doctor-patient interactions, okay? With appropriate privacy controls, that data can then be used to build machine learning models to improve healthcare. And I suspect in lots of different contexts, this forced digitization, because everything is now, essentially we increasingly interact with each other through a screen, that's going to lead to opportunities for AI, because it's going to be better, there'll be more data and better data, which is going to lead to opportunities for AI. Whether by 2025 that's transformative, I don't know. I'm willing to bet on 2040. I'm not willing to bet on 2025. And there's an example of that. So my graduate school research was about the internet. It was the late 90s, and the internet was this exciting new thing. And so that was my dissertation. I studied the internet, but I was actually looking for a job after the crash. So my job market was 2001, 2002. University of Toronto took a bet on me, and that was wonderful. But I remember having a meeting shortly after I arrived with my senior colleagues at the university, and other people said similar things, which is that, look, you had this great paper about the internet, but it doesn't really seem to be a thing anymore. So you should move on to do your other work on branding or whatever else, because the internet in 2003, 2004, 2005 seemed to be not that exciting relative to, say, measuring the value of a brand. Looking back at that from 2020, that's crazy, right? And so I'm very hesitant to make a bet about where AI is going to stand, even because of this. It might be better that, in 2025, because that kind of feels like the same 5 years after the hype peaked. And that makes me think we might very well be in that, should you really be studying this phase? I'm willing to bet that by 2040, we're going to have massive transformation because of machine learning and the opportunities of machine learning. Whether it's going to take 2 years, 5 years, 10 years, we'll see.
And I'll take a bet on 2060, and I hope I'm there to pay it off if I lose. Alex.
I would agree generally with what Anita and Avi have said. I would say I think life is going to change. What I'm not clear about is the magnitude of change, right? And I think of change happening in 3 dimensions. One is, I think, at the government economy structural level, I think there's going to be change. When you look at kind of what the governments that are starting to think ahead now, they're starting to talk about using this as an opportunity to remake the economy, right? You see that in Canada, you see it in the US elections, like Singapore, which is where I grew up, is starting to talk about that. How do we use this as an opportunity to kind of restructure the economy and pivot the economy to where we're going to? That's one level of change, but it's unclear to me how much that will progress, right? But that's one driver of change. The other driver of change is the change I already talked about, which is industry change. I can speak about retail, but think about airports, right? Airports are some of the most lucrative dollars per square foot in the world, but they've been built around experiences, right? People being in close quarters. How is that going to change, right? Because now they're going to pivot to much more around space and safety, and that changes the economics of that model completely. So you're going to see industry change. I think you are going to see changes in the way we live and work, right? That will tie to structural inequity. Just the fact that a lot of us are working from home today, right, I think is a sign that you will see people start to move away from urban locations. You will start to see, I think, technologies that support the way that we have to work in a more hybrid manner. But again, what I can't tell yet is how much that's going to move in a direction. It could be 2025, could be 2040, could be 2060. That's not a bet I'm willing to make. I just know it's going to change. I just don't know how fast it's going to be.
All right. Am I weighing in on this one?
I'm going to give it. So Avi, I'm going to give everyone 30 seconds, and I'm going to try to focus you a little bit, but we're getting out of time. And Anita, Avi, you two, academics tend to be critical of the current world, but really with a positive intention of making the world a better place, and especially for those of us who work in healthcare and health systems. I'd like you, if you could, just take 30 seconds, and Avi, you could ignore my question and then do whatever you want with it. But what is the silver lining that comes out of COVID? 30 seconds maybe for each of you. And Avi, again, you can ignore it if you want to use your 30 seconds for something else.
It's hard. This is terrible. So, we can pretend, we have lots of great data and we didn't have it before. But at the end of the day, I don't know, I'm not really a silver lining on this kind of guy. I feel like, yes, we can identify, this particular process will be better, that particular process will be better. But in the grand scheme of things, there's a global pandemic, and I don't really, I'm not really interested in identifying a silver lining from it, for better or worse.
Okay.
The loss. Thank you. The loss of life is tragic, and it's very difficult to say. I agree with Avi. That's very difficult to say there's a silver lining. If there's one big impact of COVID, though, that I think has been that provides us with an opportunity to get some productive momentum to making things better, I would say we can think of this as a great reset. Each of us has to think about, what were we doing that really didn't make sense, that we shouldn't have been doing, that wasn't in our long-term interests? What's important to us? How do we want to collaborate and cooperate? How do we want to stop wasting resources unnecessarily and start to actually, focus on, creating better lives for ourselves and for each other that are sustainable? And I think there's a widespread movement toward that kind of thinking, and that is encouraging, if nothing else.
Thank you, Anita. Alex, 30 seconds on the bright side.
I think it's, first of all, what this crisis has really exposed, I think, is just, to Anita's point, I think the structural gaps in the way we support people live and work, right? So that, unfortunately, I guess the bright side, I think, is that hopefully, my hope is that drives momentum for change, right? That we do create political will and employee will and citizen will to address some of these gaps. Some of the inequities we see for, indigenous folks and, people of color and, women, right? I think what that's brought, I think that's my hope. And then I hope that I'm right, and that will be a bright side.
Okay. Thank you all for that. Just reflecting on your final comments there, none of the challenges that we're experiencing today around inequities, for instance, are new. And if anything, the pandemic has really created a call for action. And I'm hoping that will last. The challenges in our health systems, the challenges in our economy have been here for some time. And this has really put those into perspective. I want to thank Avi and Anita and Alex for a really great discussion. I know we can go on much longer, but we want to respect the time of our several hundred people who've joined with us today. One of the many challenges of the pandemic from a business perspective has been that as our knowledge grows, the guidelines continue to evolve. And I think you've provided an excellent framework, all three of you, which can help us change the decisions we make, how we serve our employees, our customers, and other stakeholders. As I mentioned at the start, this is the 11th and final episode of our Managing Uncertainty webinar series. I hope you've all found them helpful and informative. When we began the series back in April, a very different time than today, we said that our goal was to bring together the Rotman community and offer well-informed perspectives on issues that are top of mind. We wanted to share advice, both strategic and tactical, for managing through the current challenges to get us to a better place. And while the work of understanding COVID-19 crisis is far from over, as we've talked about today, I'm sure it will be studied and written about for many years to come. We hope we've provided a few insights, new perspectives, tips that all of you have found helpful. So this series is coming to an end, but of course we're not going anywhere. In fact, just this week, we're welcoming a new cohort of bright, motivated MBA students back to Rotman, and I'm already feeling inspired as we begin the new academic year. It's a different academic year, but we've got a full class, and they are eager to be here, eager to learn, and eager to put what they take from Rotman into action in a very different world, possibly 2 years from now than the one they left when they came to join us. I'm sure these students are going to be a key part of our country's recovery and their country's recovery, because so many come internationally. So our deep thanks for joining us today and for being part of our Rotman community. If you missed any of the previous webinars, you can find the recordings on our website at rotman.utoronto.ca. Thanks again, everyone, for joining us, and be well, be safe, and stay connected with us.
Thank you, Brian.
Thanks.
Thank
Take
you.
care. Bye.